Good day to all. Today we are here on Health Talks, and I am Dr. Dhanadivya, periodontist and implantologist with more than 10 years of experience. And we also have with us on our show Dr. Deepak Moses, who is also a periodontist and an implantologist with more than 17 years of experience. Today we are going to have a very interesting topic, and the topic is on women's health, that is women's oral health as well as children oral health. Now, if you talk about women, women have, they go in a lot of multiple phases. You have the child phase, the teenage phase, then they come to the adult phase, then, the perimenopause and the menopause phase. So when you talk about the most important or, the most lot of doubts which people have in the mind is the pregnancy phase. Because a lot of times what happens is the pregnancy is a time when we don't know what should be done and what should not be done. So we want to talk about that and discuss. So I would be talking to Dr. Deepak on that. And then later we would talk about post-pregnancy, once the child is born and how, when the child should go to a dental visit and what all the, what all should be done to a child as a child care. So, Dr. Deepak, I just have one question for you. Now, pregnancy is something which is, very important phase in a woman's life. So, is it safe to visit a dentist during pregnancy, and is it the right choice also?
Nowadays, it's very, very safe to visit a dentist. Most dentists are very qualified and can easily manage pregnant women. Now, as far as pregnant women are considered, there are 3 different periods: the first 3 months, the second trimester, and finally the last 3 months, which is the third trimester. As a dentist, we generally do all sorts of treatment for pregnant women in the second trimester, which is generally considered the safest. The first trimester is generally not the safest because the organogenesis or the development of the child takes place. The third trimester, the last 3 months, could be a little dangerous as it may cause a premature delivery for the mother. So the best time to do any sort of dental treatment is in the second trimester. So what and all can be done in the second trimester? It could include smaller fillings, simple extractions, regular scaling of teeth, any sort of minor procedures that has to be done. All this can be done in the second trimester. Another common problem that most women patients have during pregnancy is the growth or the enlargement that they have in the gums. So this can be because of hormonal changes. So any sort of hormonal changes, any sort of enlargement that occurs because of hormonal changes, these treatment also can be done in the second phase. So generally, the second trimester is the safest time for any sort of dental treatment. X-rays can also be taken with proper precautions, and basic palliative dental care can be safely done in the second trimester for most of the patients without any discomfort. The important thing that you should understand during dental treatment in the second trimester is to reduce the chair time and to keep the patient comfortable during the dental procedure.
Okay, so you mean to say only in the second trimester is safe. Now, what happens if a toothache develops during the first trimester or the third trimester? So how are they supposed to manage this? Because, generally it's considered that you're not supposed to take medications and all that, So how do you handle the situation in the first and the third trimester?
So nowadays, again, a lot of medicines are available after referral from the gynecologist. The dentist can then prescribe these medications for the safety of both the mother as well as the child. So the important thing to note here is that it's very, very important to take good oral health right from before the pregnancy. So nowadays, most dentists encourage the gynecologist to also impart the importance of good oral hygiene in women patients even when they are planning for pregnancy. Because generally during the course of pregnancy, it becomes very difficult for both the mother as well as the dentist to sit through long procedures. So if good oral health can be maintained even before the pregnancy or when a pregnancy is being planned, throughout the course of the pregnancy, it can be quite smooth, and smaller problems can obviously be very well treated in the second trimester. As far as medicines are concerned, generally, if a dentist has an issue with treating a mother during the course of the pregnancy, the dentist will generally refer the patient back to the gynecologist to choose the right medicine, and therefore the treatment can go ahead smoothly. So there is no problem with the terms of medication, either antibiotics or painkillers during the time of pregnancy.
You were talking about this hormones, right? Now, hormones, you said that it's going to have an impact on gums and it's going to cause, inflammation or the enlargement of gums. What about caries? Is there any chance that pregnancy gives rise to a high risk of caries development? Is there something like that?
There's no direct link between high caries risk during pregnancy. However, during the course of pregnancy, especially in the last 3 months, the last trimester, women generally have difficulty in performing good oral hygiene procedures that are instructed to them. So they might avoid not brushing at night. They might avoid using a mouth rinse. So this can cause the increased risk of caries. Like I said earlier, it's very, very important, even when you are planning for pregnancy, to visit your dentist, get a checkup and done. If there are smaller cavities that have to be filled, they can be filled at that particular point of time. If anything else major has to be done, it can be done in the second trimester, again in the 3rd to 6th month, which is a safer period for treating pregnant women. Otherwise, as there is no direct link between caries and pregnancy, it's very, very important that the mother during the course of the pregnancy should maintain good oral hygiene and also brush the teeth at night, which might become a little difficult as they enter into the 8th month or the 9th month. However, if they can do all this, they will have good oral health during the course of the pregnancy.
Okay, so you mean to say that, do you think that oral health annual checkup, something like that, should be mandatory for women? And do you think that is the best policy to be followed? And how is it?
Yes. So again, it's very, very important to take women patients for regular checkups right from the time of puberty. So at the time of puberty, what happens? There is a hormonal imbalance that takes place. Along with that, we also have something called as an ugly duckling stage. So the child might have a malocclusion at that particular point of time. So the teeth are also not aligned properly. There is also a hormonal imbalance that is taking place. Combine both these factors, there can be a lot of inflammation that take place in the child's oral cavity. So it's very, very important to do a good checkup at that particular point of time. And during pregnancy also, it's very, very important. Pre-pregnancy or in the second trimester, it's very, very important to maintain good oral hygiene. You can always visit your dentist for the same. Towards the end of a woman's cycle, that is towards menopause, again, there will be changes inside the oral cavity, like dryness of the mouth or tenderness of the gums or thinning of the gums. So these factors can also be easily managed by a dentist if you go early and we are able to identify these issues, and these can be managed very easily by the dentist.
Okay, so ultimately, a thorough checkup from puberty till the perimenopause stage is the ideal, according to you, for any women's betterment of any women's oral health. Is that true?
Yes, that's true. So it's very, very important to check the women's health throughout their life cycle.
Okay.
Now, coming to children's teeth, it's also very, very important that the parents take the child to a dentist. So according to you, doctor, which is the best time that parents should take the child for the dentist, and what is the general procedures that a pediatric dentist can do for the child?
Talking about this, any child once born, that is before the tooth erupts into the oral cavity, from that time itself, you have to, take care of your gums. So now when there is no teeth at all in the oral cavity, you will find something called as the gum pads. Okay, so either with a soft gauze or a cotton piece or something, you have to always clean, because generally what happens, the baby is on either the mother's milk or it's going to be on a formula feed or any other supplement feed. So that time what happens is that there will be a layer which is formed on the gums. So it is not always right to just leave it like that, because in the first 6 months what happens is you're not supposed to give water to a child. According to the Pediatric Association, it is recommended that it should be exclusively only the mother's milk. So what happens is this white layer will always be formed. So in that case, either use a gauze and then, just orally just put your finger with the gauze and then wipe the gum pads. And ideally, if you ask me when is the right time that you take your child, ideally by 6 months, at least the first tooth erupts into the oral cavity. So at least by first birthday or by the time the child completes 1 year, it is the right time to visit a dentist, because that time you will know whether sometimes the child is affected by something called as nursing bottle caries, because of continuous milk which is present there, the teeth can start eroding and develop caries. So all that can be identified at a very, very small age, because early childhood caries is something which is so much common nowadays because of our dietary habits and all that. So it is always best, the first visit should be somewhere around first year, just close to the first birthday of the child.
Okay, so moving on with the importance of baby milk teeth, how important is it to save the primary teeth or the milk teeth that is present inside the baby's mouth?
Okay. As I mentioned, the first tooth to erupt into the oral cavity will be somewhere around 6 months. Okay. And by the time the child is around 6 years of age, almost the complete complement of your primary dentition, that is the primary or the milk teeth, is totally erupted. Now, if you ask me how important is it, because this is going to help the child in chewing, this is going to help the child in speech, and this is going to be the tooth which is going to be a precursor for your permanent teeth. Now, if you do not maintain this tooth, then, if you go in for early extraction of this tooth, the permanent teeth which has to erupt at the particular age will not fall in that same chronology, and it can, cause crowding in the later stages. So it is always better you go for a periodic visit, and you have to, if at all the patient or the child is affected by caries or, some pain or something like that, it's better to get treated and maintain that primary or the milk teeth, because that is going to be a forerunner for your permanent teeth, and the alignment, everything depends only on your milk teeth. So it is very, very important for a child chewing, speech, as well as the future permanent dentition. The primary teeth is very, very essential.
So children's teeth are very, very important. So many a time we see that most parents bring their children to the dentist, especially with a complaint of forwardly placed teeth or malaligned teeth. Is braces really important, and what are the different types of braces that are generally available?
Yes, because braces is very important, and sometimes a lot of people come and ask me, what is the right age do I start, clip treatment? That's the general common terminology which they use for, among people. So the ideal age you go in for an orthodontic treatment or an orthodontic opinion, because the orthodontist is somebody who aligns the teeth of the, a child. So the ideal age is visit when you're around 6 to 7 years, because what happens is by the time of 4 to 5 years, you will have a habit of thumb sucking. Some children will have mouth breathing. So all these conditions can be taken care, and some habit breaking appliances can be given by the orthodontist. So these are called as functional appliances or myofunctional appliance, which is there even before, all your permanent teeth erupt in the oral cavity. So you do not have to wait for your, all the teeth to erupt into the oral cavity, which will be somewhere around 13 years of age. That time the child is in the growth phase. Sometimes by 13, the whole jaw is completed, the permanent teeth are all erupted. But if you go at 7 or 8 or 9, that time, if there is any habit like mouth breathing or if there is any thumb sucking, they will give you some habit breaking appliance. And considering that patient is in the growth phase, if you need to either control the growth, they will be giving some headgears or some chin caps, some appliance like that, which will help them to, align the teeth in a much more better manner, not only taking the teeth into consideration, but also the facial profile into consideration. So ideally, if you go to an orthodontist by around 8 or 6 to 7 age, that should be perfect. And that will help them to, align the teeth, not only just dentally, but also facially in a much more better manner. And talking about the various types of appliances which is present, you have ceramic braces, you have metal brackets, and you have also these Invisaligns. But the right choice, whether you should go in for an Invisalign or whether you should go for a ceramic appliance or a metal appliance, the orthodontist will be the right person, because they need to take a set of x-rays for you, where will they see the oral cavity fully. There's all the set of teeth, plus also your profile x-ray will be taken. So once they take that x-ray, then they will be able to analyze which kind of braces, whether Invisalign or metal braces or metal ceramic braces, which is going to be ideal for you, will be decided by your orthodontist.
Thank you, doctor. Now we also see that a lot of children come with a lot of caries nowadays. Is it because of junk food, or what is the reason why these children come with a lot of caries nowadays?
Okay, now the thing is that you go and tell a child, do not have chocolates, they're definitely not going to have. Okay, so the best thing is that the caries happens because of the activity of this bacteria throughout night. So as parents, you have to step in here. You have to inculcate the habit of night brushing in your child. And it is not only chocolates which is the culprit which is causing this. Sometimes what happens is your saliva will have the tendency to produce more caries, because there'll be some people who eat so many chocolates but they will never develop caries at all. But there'll be people who are not that, do not have a sweet tooth, but then they'll end up having caries. So it also depends on the patient's saliva and also the eating habit. So whatever if at all, as we mentioned earlier, you visit the dentist once in 6 months, they will be able to analyze whether your saliva has this tendency to produce more caries. In that case, they will put you on a fluoride paste or a fluoride mouth rinse in the night, but the activity of the fluoride will be there throughout night. So what happens is your, the activity of the caries will just totally come down. So it is always better that as parents, we step in, inculcate in the child the habit of night brushing, which is very, very important. And also, just not only sweets is going to cause this, frequent snacking of any junk food, because nowadays the use of fibrous food is like, not very common, because they always go in for this processed food. So cut down on all those food, more fruits, vegetables, and more fibrous food will definitely help you to reduce the amount of caries that is going to be developing in the child.
Yeah, so that was very, very useful information, doctor. Now, as a parent, what is information that we should generally give to a child, and how should we take care of our children's dental health?
Okay. The first thing is that I just mentioned. First thing, the child and the parent relationship should be mutual. That is, they have to make sure that they lovingly, caringly tell the patient that you have to mandatorily brush, every night. Because nowadays you go and tell a child, brush, and the way you talk to a child also is entirely different. You cannot really go and tell them. In our olden days where we said we used to do it, but now it's not the case with the child. So you have to inculcate the child slowly that this is going to give them a long-term benefit. So as a parent, brushing regularly, just not brushing regularly, probably you should also brush along with them. Okay, so the child will always watch the parent or the sibling do something like that, and then that habit will get inculcated in them. So join hands with the child, brush every night without fail, and apart from that, take your child for a dental checkup, because always there is a phobia among these children that dentist means the dentist is always considered as a monster. Okay, so always all children are very scared of all dentists. So what we do is we make sure that at a time when there is no problem at all, when you generally just visit a dentist without any problem, the child goes for a regular dental checkup, he becomes more friendly and he knows that the dentist is not going to harm. So regular checkup, regular brushing in the night, and also stop this habit of, rewarding the child with, if you do something, I will give you a chocolate, and that rewarding system also should be cut down, because most of the parents, chocolate is bought by the parents only. Okay, so the child is not going to go and get the chocolate by himself. So you have to make sure that you need to put a foot down and cut down on these junk and this processed food. And as a parent, inculcate the habit of more fibrous food, more healthier food. So that way, these small things, if we do it along with the child, I think we can cut down this problem of caries and other gum diseases in a much faster rate, in our own country.
So thank you so much, doctor. We hope today's episode of Health Talks is very, very informative, and you heard a lot about oral health and how it's linked to children's health and women's health. Thank you.
Thank you so much. It was an absolute pleasure having you here with us. Thank you.